Okay. Eldo, did you look at that presentation I sent you on aspirated?
I didn't get time. I didn't get time.
Okay. Eldo sent me a query about the how to clean an aspirator tubing after surgery, and I've revised it. Okay, and I need to send it to you all. Okay, 1 second.
You know, how do they clean those metal suction tips? Do you still use metal suction tips, or is it all disposable plastic tips that they use in UK?
Those plastic ones are for plastic people, I think.
Plastic ones are?
I think those plastic tips are for plastic people. They're dreadful. The metal aspirator tips are much better, much more precise. But do you have aspirator tubing, aspirator tip cleaning brushes?
Not as such. I searched for it today. It was not available. The company that supplies the metal tips, they give a kind of, what to say, an orthodontic wire kind of thing to clean inside. Which I felt that it is not the exact thing. There should be something like a bottle brush.
Yes.
Which I searched for it today. I sent the boy, but that was not available. But next Thursday when I'm free, I'll go and search for it myself.
Yes, there must be some shop that you can buy these that aren't dental.
Yeah, what I thought is, you know, those shops supplying this lab things like pipette and test tube and all that.
Yes.
They should be having something to clean the pipette and test tubes and all that.
Yes.
I'm just planning to go to such a kind of shop and then ask about it.
So you didn't see the brushes on my presentation yet?
No.
No. Okay.
Yeah. I just opened it in another computer. Yeah, I saw it. Yeah, this was the same thing in my mind. Yeah.
Have you bought the shower?
Reducer.
Have you bought the shower attachment?
No, I didn't get that. I'll go next Thursday to search for all this.
Yeah.
I was having terrible cold this week, so I couldn't go out.
What attachment? Shower attachment.
What he's talking is that reducer from which you can. That's what he meant.
Yes. Just let me look for something a minute.
Reducer that can reduce the, you know, original to convert in the reducer.
Sir, gooseneck.
Gooseneck, yeah, gooseneck is not actually available
No,
here.
Was it for that or other connect sir?
Yeah. Same thing. It can be connected to it, and then you can connect your aspirator tubing into that. So you need a reducer for that. And it's always they get cold water, so they need to mix to make it warm water. Otherwise, you cannot, touch the water because it's so freezingly cold. That is why they have 2 taps and all that. We don't actually require that. We only need a, gooseneck and long handle.
Yeah.
Ashwin, what can you see on the screen at the moment? Can you see aspirator manifold and tubing?
Yes. Yes.
Okay. So at some point you need that, as you know, and this tubing. Okay, now Eldo's got some, and it's much easier to handle this than handling the tubing that's attached to the manifold.
Okay.
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 It's just easier to use, isn't it, Eldo?
Yeah, very much. My goodness, it has changed my life.
Yeah. So it's set up with the metal aspirator tube already attached. Okay. When you double bag it.
Okay.
And
And
this-
how do you clean this tube?
with this.
How do you?
Not,
How does
not the
this
tube, not the tube. He's saying with this bottle brush, he's saying that you can clean the suction tip.
aspirate suction tip? So what about the tube?
Tube,
Okay.
you have to pass water through the
That's all.
from the gooseneck.
Okay.
Ashwin, do you see this? I'm going to send you this presentation, okay?
Okay. Okay. Okay.
It shows you how you use it. And what you do is, just 1 second. You buy one of these shower hoses, okay?
Okay.
And you take off the tip here. You see the
Yes. Yes.
okay. And then you put it onto your tap,
Okay.
and then you attach this, okay? And you let the water go through for about 5 minutes. Okay.
Okay.
And then when you've done that, you attach it to your aspirator again, just to clear the water out of it and dry it.
Okay.
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 But there's so much easier to use.
Yeah, this is available, sir. We have these kind of reducers. This is available.
Yeah, we should
Yes.
try it. We should start searching it.
Okay. But you need to, when you're rich, Ashwin, you need to buy this tubing from
Salvin.
Salvin, yes. Oh. Okay.
Anand, your hairstyle is good.
Thank you, sir. How are you, sir?
Very good, very good. How are you?
Fine.
Any proposals?
Okay, we're going on to gowning
Where is it?
and gloving.
Rajesh went, huh? Rajesh.
Okay, just 1 second. Okay, you can see this gowning, can you? Gown procedure. Ashwin, can you see this?
Sir, I can see many slides. Recommendations to change the mask in a non-aerosol environment.
Okay, I've gone to slideshow, which is now on my laptop rather than the other screen. What happens? Just 1 second.
Yes. Now gown procedure.
Yeah. So, and you can see the little slides on the left there.
Yes.
Okay, well, we'll just have to go with this, okay? So when you're doing implant surgery, then you need to gown with protective clothing. You need eye protection and glasses or a shield. Have you tried shields, Ashwin?
Yes, yes, I use it.
You use a shield?
I use it, but in some situations I remove it because it all starts fogging and we just throw everything in.
What
Yeah.
about the sound of your voice? Does that affect it? Is it affected by that?
I don't think not
It
much.
is. It actually affects, and even with the two masks,
Yeah,
it
two
affects.
masks. Yes.
You know, some funny thing. Yesterday, it was orthodontic day here. So one patient who came sitting in the reception came to sitting in the waiting room, came to the reception and complained that another patient sitting in the reception is not double masked. We had to supply another mask to the patient who was sitting in the lobby.
So what did you say, sir? Did you say that?
I was not there. I was just telling today that the patient came to the reception, complained that the other fellow is not wearing two masks. My goodness.
Yeah. Okay. So masks. This is for protecting against the aerosol, blood, saliva, and calculus. When you're flicking calculus off, sometimes it goes into your mouth if you're not careful. I've said this before, that in an aerosol environment, you should change the masks every 20 minutes. This is what the research shows, but nobody ever does. And if you're in a non-aerosol environment, you have to change them once an hour. Most people use one for the whole day. I've seen
Sir, it
dentists.
tend to fog also, so like with the mask
Huh?
and the face shield, with mask and the face shield together, I felt like it starts to fog. It's quite
Mhm.
difficult to fog.
Fogging, yeah. Fogging.
Yeah.
Yeah. Fogging, for that you can put that micropore, it helps a lot.
Okay.
Micropore
Just on
over
the
your
nose pad above the mask, above
nose.
the nose
Yes.
pin. Just put that micropore. It will help.
Is it micropore?
Sir?
What does it mean by micropore?
Micropore is that sticker, sir,
Tape.
for plaster
Micropore
sticker,
tape.
for
Okay.
that white tape.
Paper.
If you cut yourself and you go to the casualty department, they'll
I understand. Yeah.
they'll put that on there. Okay. It's also what they put on you after when you're having intravenous sedation. When they put the needle in and they put micropore over it to hold it.
Something
hold
like
it
a
in place.
band-aid kind of thing.
Yeah. Okay.
Yeah.
You see quite a few people who hold have their mask like this, useless. Here they've got no cap, no eye protection, and no mask. These gowns are fairly routine nowadays. You have to bear in mind that this is the area which you can consider to be aseptic. If you put your hands onto your lap, you'd have to change your gloves. Okay. You see this man's arm, hand is below his waist. You shouldn't have your hands below your waist. Okay. And everybody in the room should be watching for this sort of thing. And as soon as you see somebody do this, you correct them straight away. Okay. This was in a DVD I had on asepsis in dentistry. And they weren't pointing out that she wasn't standing correctly. Okay, dreadful. And and they showed this as well. I mean, the first thing you do is to put a cap on. Then you put the mask on, then you put the glasses on. When Dr. Tatum and I were running the course here, his Tatum year course, sometimes somebody would prepare their hands, they put the gown on, they put the gloves on, and they'd be standing there without a cap on. And Dr. Tatum would say, start again. A little bit cruel. So these are presentations which you can use with your staff. Okay.
Yes, I went through this. I went through the previous one with my staff.
You did, good. Okay. Now opening a gown pack. These are commercial ones. If you do them in cloth, then you need to pack them in a way that you can open them like this. You notice that she's stretching the sides, the ends, so that it doesn't fall back onto the gown. Okay. We pack 3 pairs of gloves, double pack, and then sterilize them. And when you're gloving, when you've got your gown on and you put 2 gloves on, you then pick up the other one and take it to the aseptic area in the treatment room and put it down so that if you need to re-glove, you've got an extra glove there. Okay. Do you do this, Eldo?
I keep more than 3 gloves now in that.
So we would have a drawer for small gloves,
Okay.
packs, medium glove packs, and large glove packs. And in each pack, there will be 3 gloves. How many do you put in a pack then, Eldo?
5 to 6 in each packs we place.
What you get through, you re-glove 5 or 6 times.
If at all something goes wrong, then so
Hello, if you've got 5 gloves in the pack, you've got 2 that you put on to start with. So you must break the aseptic field 3 times to use up 5 gloves.
you don't know when you would break.
Say it again.
You won't know when you break. Sometimes if you break, then then you need to go and search for it rather than that let it be there and unused. Once can again be repacked and re-sterilized.
Okay. So she's now opening up a pack onto the table where she's opened the gown pack. When they do that, they mustn't touch the gown. Okay. And you need an area where there's nothing else around. You need plenty of space when you're gowning. And certainly people should avoid coming near the person gowning. They should remove earrings and rings and things If they wear rings, if they wear things on their fingers, that can tear the gloves. So now when drying the hands, after they've washed them, you must keep their hands high above the elbows so the water drips down onto the elbows rather than going water dripping from the hands, from the elbows onto the hands. That'll bring organisms back, okay? So Christine here has already washed her hands. And now you'll notice here how she's picking this up. Okay, she's crouching down. She's keeping her elbow below the work surface and her hand up. Okay, so that the water does not drip onto the gown. Do you do that, Eldo? Can you unmute?
Not so religiously.
Well, you either do it properly, you don't do it. Okay? It's just as easy to do it correctly as incorrectly. So you could be dripping water onto the gown and infecting it. Okay? This is a religion. Okay? Are you ready, Ashwin?
Yes, sir.
So could that platform be a bit higher, like instead of?
Say it again.
So could that platform be a bit higher while picking up the? Is it
What
okay if
higher?
that platform? Where so is it okay if that platform on which the gloves are resting is a bit higher, so that we can avoid that bending down,
The table, you
crouching?
mean? The table, if it's high, if it's higher.
It
Yes,
could
sir.
be. It could be, yes. But you're going to have to deal with the tables you've got. Even if this table was a little bit higher, I mean, you'd have to have it really high to do it without crouching down a bit. Okay. You watching this, Eldo?
Yes.
Okay. Now, you must lean forwards a little bit so the towel doesn't touch your tunic. You start by drying the hand and then running down onto the elbow. Now you don't go back again with that towel. Now you can pick this up with the dried hand because there's no water to drip. Do you have two towels, Eldo?
Yes.
Yeah, good.
So you have these big towels or the smaller ones?
So we keep cloth only.
Cloth.
Okay, now gowning. You must have the gown away from your uniform. You should be leaning forward a little bit. And then you shake it out because you don't want to be touching the surface on the front of it. And you don't have your hands coming all the way through. And then you turn and now you see how the person comes up and runs her hands under the person's arms like this to pull the gown over the person's shoulders. Do you have ties, string ties on yours, Eldo, or do you have
Yes.
Velcro?
Yes.
You could buy Velcro and have it sewn on.
No, Velcro, the problem is Velcro, sometimes it gets you tightened so much that you're so tight inside. With this ties, it is better. You can slightly loosen it, or otherwise the Velcro they attach it onto the borders uh, of the cloth. So once you tighten it, you might feel so suffocated inside. So I prefer a tie than a. We have Velcros also, but I never put that Velcros. Always tie it.
I would have to look at that. Now tying the inside one. Now, I don't know whether you do this, Eldo, but when you pack your gowns, do you put some string, some cardboard like this
No,
through the ends?
no.
That would be very easy to do.
Okay.
Okay. You just make 2 holes in the cardboard and run the tape through.
Okay.
Now just watch this now. Ashwin, are you still with us? Just watch this now. She's picking up the cardboard and handing the other end of it to the roving assistant. Okay, she then turns and takes the tie, and then she tightens it. So the roving assistant doesn't tie the outer string. And then the person should stand like this. Did you get that, Ashwin?
Yes, sir. Can you run from the middle, please? Yeah. Yeah.
Okay, so the back's been tied at the top, and there's an inside string. Let's go back a bit more. So the top one's tied.
Yes.
This is with Velcro, this one. And then you see there's a tape there just by his hand. You see that tape?
Tape.
String.
Okay. Yeah.
Yeah. Okay. And there's one on the inside. You see that one?
Yes.
So he ties that.
Okay.
Now, there's 2 more ties. One on the left and one on the right.
Okay.
And she takes the one with she's now got the one with the longer one with the little piece of cardboard in her right hand, and she's got the other one in her left hand, the shorter one.
Okay.
Okay. Now, she
I mean
then,
that she takes it by herself.
yes,
Okay.
the one on the left, she's holding with her glove, with her hand inside the gown. Okay. And she's holding out the card a little bit like this. She's holding it out like this. Okay. And he's taking this part here. Okay. And then he then takes this and brings it round to the other side. So he's not touching the string at all.
I'll be back in a minute. It's just a minute.
Okay.
Raining heavily. Can't hear. Getting the earphone.
Okay, we'll wait for you, okay? I think, Eldo, it's a decision whether to do things properly or just half properly,
I understand.
you know. And I struggled with this for a while. And then, you see, I was fortunate in having the Tatum year course here for 3 or 4 years. And they came about 15 or 20 of them once a month for about 5 days. And so in teaching them to have a high standard,
Yeah.
it just improved my way of doing things, you know. And you see, bear in mind, Eldo, that if you teach at this level, it's unlikely, if you teach at a very high level, it's unlikely that they're going to work at a higher level than that.
Yes.
Okay. But so most of them are going to be somewhere down here if you go and visit them.
Yeah.
Okay. Now, if you teach at this level, they're going to be even lower.
Yeah.
You know. I mean, have you ever met Dr. Tatum?
Yes, I have.
He was extremely hard on me and still is. And when I took over, running my own year course, I decided not to be hard on people the same way as he was, because I felt that if there was a reasonably nice atmosphere in the room, people would be happy to say, oh, you just infringed the aseptic field. You need to change your gloves. And even if I hadn't, I still would change my gloves to encourage the people to be very vigilant in looking, okay? Okay, so Ashwin, so she's got the shorter string in her left hand, and the longer one she's giving to the roving assistant. And then she is going to turn round and he then holds it there, and she takes now the string and pulls it out of the cardboard.
But in our we don't have this, no, sir. We in our own.
We get it. We get it.
SMS.
If you buy a surgical sterile surgical pack, you get all this.
You don't have what?
So I mean, the gowns that I buy, I don't find this card and all.
No.
No, you get it. You try getting it from. We are just getting a surgical gown we call, but if you try to get one sterile one as such, they have all this.
Are you using
What we
ones?
get is sterile, no? What we get in that SMS gown, that's sterile only, no?
No, what I'm presently getting for Corona, after Corona, it's not sterile.
It's not sterile.
It
The
comes in a
plastic one.
plastic cover. It's not sterile.
I thought it was sterile. Okay. Okay. Okay.
Yeah, I'll get you one. I'll get the picture
Okay.
that we used to buy like that. Yeah.
Okay.
So are you using disposable gowns, Ashwin?
Yes, sir.
Okay.
So, but what about cloth gowns? If cloth gowns,
You
I
can
think
make
outside-
it like this actually.
okay, you can put a card or something like, and then attach it
Yeah,
to
that's
the.
what when he said I was thinking, yeah, that's a good idea.
Okay.
I came to the conclusion that the amount of time taken putting all the cloth stuff into a washing machine, drying them, folding them, packing them, and then sterilizing them. I mean, the autoclaves can take about 2 gowns. Takes a lot of work. If you're overstaffed like Eldo's clinic, then that's fine. But it really is a lot of work. Anyway, okay, this is the ideal way of doing it.
Okay.
This is how they teach you how to put on a Salvin type gown. Okay. Now she's tying it with her hands still in the gown. Okay. She doesn't put her hands through the gown so the hands come out. Okay. They're in the sleeve of the gown. And then she stands like this, not dropping a hand down. Okay. Now, here she's gloving with the gown on. The gloves we've already seen have been tipped onto the work surface, onto the surface. And now I'm showing you this, and we're going to go through this in detail in a minute.
So how much time will it take to gown and put gloves like this?
How long it takes. Okay. How long does it take to prepare a really good crown? Preparation that you'd be
40 minutes.
proud of to be photographed. It takes as long as it takes. This is not a race. Okay, dentistry should not be a race. Sorry, I did something there. Okay, now. Just 1 second. Can you see this? Can you see gloving for gowning practice?
Yes.
Okay. You haven't been here, Eldo, when I've been teaching gloving, have I? Have you?
No, you have taught us in Cochin.
That's right. That's it. Okay. Now, we use kitchen gloves for practicing initially. And then using normal gloves. And the reason why I do that is it really emphasizes every detail. Okay. And it also makes a little bit of fun as well for the people. Instead of using gowns for practice, start by using a support bandage or some full-length socks, which you cut the foot off. Okay, instead of using gowns. Then use examination gloves later. So if you feel like going to a sports place and buying, or a pharmacy, you can buy these support bandages.
Are you showing a slide or something? Or
Can you see this?
No, we cannot see. I cannot see.
Oh, Eldo said you could. Can you see it now?
Yes.
Okay. So thank you, Ashwin. You need some kitchen gloves and some normal gloves. And instead of using gowns all the time, you can use these support bandages or some socks, which you cut the foot off. You got that? Okay. So you open these out and you can usually cut these into 3 like this. So you need 1 or 2 packets of these things. And then you can use these instead of using gowns. With the kitchen gloves, you need to put on the inside, you need to put left and right on the cuff, because with kitchen gloves, you have to put the left one on the left hand and the right hand one on the right hand, okay? With the clinical gloves, you don't have to do that because they can go on either hand. So the first thing to do is to turn back the sleeves. And you'll see on the inside of this, That's the left glove, okay? You see, Eldo, I would train your dentist associates how to do this. And when you're doing implant work, I would have them assist you so they can learn. Okay, so this is a setup ready with the 2 gloves and the sleeves ready.
I'll be back in a minute. You can carry on.
How are you doing at the present moment, Ashwin, with your staff?
Sir, my older staff, the first one, she's there, so I'm much relaxed. She's able to, bring her up slowly, she's able to improve slowly because of the other staff. She's a little slow in, catching things. Right, I mean, the grasping power is a little less, but she's slowly coping up.
Ananth, Ashwin's got 2 members of staff, one who's been with him a little while and a newer one who is a little bit shy and a bit slow. When I took over my dental office clinic in Northampton in 1978, the old dentist who was retiring said, of all the things in dentistry, the most difficult thing of all is staff, not the patients, it's the staff. And I think that, Ashwin, you probably would agree with that. Most of the other things you can control to some extent. Staff is the most wild situation. It's very difficult.
To get a sincere staff is like getting a precious jewel,
Yes. I think personally, I can think of 1, 2, 3 members of staff in 40 years worth of dentistry that I'd re-employ. And I've had many members of staff over the years. Okay, Eldo, are you ready now?
Yes, I'm ready.
So you put these on and you don't put your fingers through, leave your fingers out, okay? And then you put on the other one. Now, these presentations are deliberately very simple and step by step so that you can use these with staff. Okay. So now you're ready to put on the gloves. And the video that I showed you of Christine gowning, you can see now in detail what she was doing. So you pick up the glove by the cuff and put it, just 1 second. you put your hand out straight like this, and you put the glove on with the fingers pointing towards your elbow and the cuff pointing towards the end of the glove, of the gown. Okay, and you notice that the thumb here is next to the thumb of the hand that's being gloved. You then, with your hand, your left hand, you take hold of the bottom part of the cuff of the glove, and you take the top of the cuff with your right hand and slip it over your hand. You're putting your hand in there like that, and then you bring this over the top.
So the right hand actually holds the inside of the left glove.
Now the left hand is holding the lower part of the cuff, okay, with the cuff of the gown, not with the bare fingers.
Yeah.
Okay, and the right hand is holding the cuff, the other side of the cuff, preferably on the underneath the cuff, okay, rather than on the cuff. Let's just watch that. Okay. So now you see the right hand is holding the inside of that cuff. Okay, not the inside of the glove, but underneath the cuff. You see, with the right hand's taking the edge of the cuff. Okay, do you see that, Ashwin?
So Rajesh is.
Thank you. Okay, so now you stretch it over onto the hand and then pull it on. So that's the left hand. Now we're looking at the right hand. Just going back a little bit. So you hold your hand out, your right hand out flat. You can see the thumb is on the right at the moment. And you put the glove on there with the fingers pointing towards the elbow and the cuff near the end of the hand. And the right part of the glove is next to the right part of your the right hand. Now the right hand has taken the inside of the cuff, and the left hand is now pulling it over onto the hand. And you have to, because the glove, because the gown, the hand was not right through the gown, you have to pull the gown down a little bit so that your hand sticks through the glove, through the gown. Okay. Now, when gloves are contaminated by touching a non-aseptic object, the gloves must be removed by the roving assistant. Now, I just wonder if you do this, Aldo. Just watch this closely now. Regloving is done by an already gowned person. So if you contaminate your glove, your assistant will reglove you. Or if your assistant contaminates a hand, you glove her. Okay. The contaminated gloved hand is held out flat with the palm downwards. This is a strict regime. So you hold your hand out like this if you contaminated your glove. This indicates to the roving assistant to remove the glove. So this is degloving the left hand. Now, you need this done near the end of the glove. If they take it a little bit nearer the hand, the glove is not covering the sleeve of the gown. And when they do this, they can pull the hair on your hand, on your wrist, which is not nice. Okay, strangely, when you're doing a surgical procedure, it's quite stressful. And if somebody pulls the hair just here, it can hurt. Whereas if they have it a little bit more onto the cuff of the gown, it doesn't hurt you. Okay. They pull and you pull to deglove. And if you really caused yourself a problem, you may have to reglove two hands. So this is degloving the right hand. Now, Eldo, unless you practice this, your staff can't do this.
Yes.
Now, preparing to reglove, on your aseptic surface, the person who's already gloved, who hasn't contaminated their hands, sets up the gloves like this. Now they pick them up like this. If they're regloving you, Eldo, this is how they'd hold them. And they then, now you've got your hand out straight like this, okay? So that they know where your thumb is. Because you need to have the thumb either on the right or the left, depending where the hand is. Okay? Because if you are being regloved and you put your hand into the glove and the glove's got the thumb on this side rather than this side, it doesn't work. Okay, that's why you put your hand out ready for the person to glove you, and the person can see where the thumb should be, on the left or the right. As I've said before, we should be doing this with gloves so you can do it. Now, the other thing which you didn't see here, God's sakes, just let me run this through a minute. Now, the thumbs of the person who's gloving the other person should be sticking out as far as possible like this. Eldo?
Yeah.
Thumbs should be sticking out more than what you can see there. Because if they have their thumbs too close to the glove, when the person putting their hand in does that, they can contaminate the other person's gloves. Okay.
So can you repeat that?
Yes. Now, you look at this. The person putting their hand in now could touch that person's thumbs.
Okay.
Okay. So they should have their thumbs stick out like this. Okay. So the person to be gloved holds their hand out with the palm downwards so that the glover knows which direction to point the thumb of the new glove.
Yeah.
You need to hold the thumbs out of the way to avoid them becoming contaminated by being gloved.
So Rabbi is waiting.
Now you see in this picture here, you see how the thumbs are right out of the way,
Yes.
right? Now, hi, Abby. As I've said to you before, you either do this properly or half properly, okay? You need to have high standards for this sort of thing. Now, do you see what I mean now about, just 1 second, go back a minute. You see how the person gloving, gloving the other person, you see how they've got the glove with the thumb on the right. You got that, Ashwin?
Yeah.
Okay, so that when this person puts their hand in, the thumb goes into the hole for the thumb.
Yes.
Now, when you come to put this over onto the sleeve, you do it very carefully, not with a great sort of phew, like this, because then it can not cover the sleeve properly.
Okay.
Got it? Now watch this one here. Okay, you can imagine that when that person puts their hand into that glove, the other person, okay, Ashwin, you're looking at this one?
Yes.
If the person who's gloving is putting their hand in, they would contaminate the other person's gloves.
This is wrong.
That's wrong, absolutely. Okay. And the other one, the person putting their hand in would keep their hand away until the person corrects that. So they take their hand away. Now it's okay. Now, if we've got, say, 8 participants on a course, we would pair them up into 4 pairs. And or rather, we'd say you've got 6 people, you divide them into 3 groups. So you've got 2 people who are going to be gloved and 1 person going to be the roving assistant. We first get them to glove correctly. And then we say to the person holding out the glove, now put your thumbs in the wrong place. And the other person comes along and stops until the person raises their elbows, their thumbs out of the way, okay? So preparing to glove the right hand. You notice that's how it should be. Okay, you got that, Eldo? That's how it should be. One second. Let me watch this again. Let me just show you this again. Sorry. Now, by this time, the person being gloved has one glove, one hand gloved. Okay. And just watch what happens. Watching closely. The other person comes towards the glove with the ungloved hand. And the person helping with the gloving takes the glove away. Okay. This time, this is correct. They're going to put their gloved hand under the sleeve to pull it out so the other hand goes in more easily. Rajesh, are you seeing this? So now you'll see that it's easier for the person to glove the other hand. Hi, Siley. Ashwin, are you okay on that? We may have lost Ashwin. Okay, now we're using proper gloves. And just watch this closely. And then we'll look at this in detail. How long does this take, Ashwin, Eldo? Can you unmute, Eldo?
5 seconds.
How long does it take?
5 seconds.
It takes as long as it takes. Okay. Ashwin, can we see you?
The current is gone, so
Say it again.
here, the current is gone over here, so I won't be able to on the video.
Okay, right. But you can see that what I'm showing you.
Yeah, I can see. Yes.
But okay.
Come.
So this is the practice session. Putting the gloves out.
Sir, Tejas is waiting.
Thank you. So this is setting up, ready for practicing. So you then put on the sleeves. Hi, Tejas. So the thumb is next to the thumb. Then have to pull the sleeve down a little bit. Try not to expose the hand or the arm. Eldo, once you get used to this, it doesn't take very long to do. Okay. I think we've just done this. Okay, now gloving the right hand. When you pull the sleeve down, you shouldn't really expose any of the hand. Need to make sure that it's really well covered onto the fingers. And then the praying position. Degloving. If you contaminate the glove. Just let me show you this here now. We'll just go back a minute. This is where, if the person degloving has their fingers closer to the hand, they can pull the hairs. Are you aware of this at all, Tejas? When they're degloving, they need to be taking the glove over where the cuff is of the sleeve. If they have their hands a little bit closer to the hand, they can pull the hair on your hand. which is not pleasant. Okay. So this is degloving the right hand. So the person puts their hand out like this, so that the person doing the gloving knows where to put the thumb of the glove. The thumbs of the person doing the gloving are right out of the way. That's pretty good. Okay. Now watch this very closely, Eldo. You see how the person being gloved does this. So the hand goes into the glove more easily. Okay. Just see that again. Person doing the gloving has their fingers inside the sleeve. Okay. Now just watch this. And everybody in the room should be watching to make sure there aren't any infringements. So the person being gloved takes their hand away because the thumbs aren't out of the way. Somebody in the room should have said thumbs then. Now, if you watch closely, this person's got the other hand gloved, and the person gloving takes a glove away because the person hasn't done in this. Now you should be able to watch what's going on much more closely now in detail because of what we've been going through. I'm asking you a facetious question, Tejas. Is this how they do them? Is this how they do it in the hospital?
I've never seen this before.
Now, okay. Omitting Ashwin. So, draping the patient. This is using a wrapped drape pack. And I know you've got some drapes, Eldo, but look closely at what I'm showing you here in case you need to make some modifications. So this is the pack ready for somebody to open.
Stuart, can you make it full screen?
Oh, sorry. Got it?
No.
Okay, so this is the patient draped, ready to start the surgery with the
It's the same.
Say it again?
It's the same. Can you press F5 on your keyboard?
F.
5.
What has that done?
Function 5. It'll turn the presentation into full screen.
Yes, I can't do full screen.
My screen is small. Okay, go ahead. We'll
Yeah.
continue.
No, I'll tell you why. When I go full screen, it goes full screen on my laptop and then I can't see all of you.
You have like a gazillion screens in front of you. What happened to that?
Have a what?
A gazillion screens in front of you, monitors. What happened to that?
The sound on my new computer with the two big screens is absolutely terrible. I couldn't hear a word anybody was saying. So I'm now on my old computer. Well, let's say it's old, it's quite new. And another screen, okay? Now, when I open up Zoom, it opens up on my laptop, okay? If I open up the PowerPoint on my other screen, when I then go to full screen, it goes onto my laptop and covers up the, I haven't solved how to, because I can't move.
I'll get on a Zoom, team viewer call after this with you. All right, let's continue.
That'd be good. Okay. So this is the wrapped pack that we use. This is having opened up the pack. And then this is the type of drape which we always used on patients. Okay. I might possibly have had one patient who felt claustrophobic, in which case we had to tear the top so that they could see out. But otherwise, Mind you, all the patients were sedated. Pretty well all of them.
Sedated with what?
Midazolam.
Okay. That's a
um,
very short acting sedative.
Intravenously.
Okay. Somebody monitoring that continuously.
Yep. Yep.
Oh.
On my year course, we'd have a sedationist dentist and a sedationist student. So depending on the ability of the student, they would hopefully do most of this sedating, okay, and monitoring. Okay. I might have done 1 or 2 patients under oral sedation. I had a friend of mine who was a dentist in Boston, who was from Gujarat, and he didn't sedate any of these patients because they didn't need it, which meant that he wasn't into finding out how patients felt. Also, if you've got your patients intravenous sedated, you're more inclined to use a mallet on and expand. Okay. Now, if you're putting implants in where the ridge could be expanded, but you don't know how to do it, that patient is paying for 2 surgeries, one for the grafting, and then 6 months later for the implant placement. So you make more money, but the patient pays more. I would personally, if you don't do intravenous sedation or don't have somebody who could do it for you, I would almost routinely give them some sort of oral sedation. I think it's just a kind way of doing it.
Okay.
Okay. And you're more inclined to do a proper job. Okay. So this is the drape. There's the hole. It's got a paper covering to the sticky part of it. And you tear that bit off. Oh, these are the measurements, Eldo, if you wanted to take these measurements, okay. And make some good cloth ones. So he's ready to drape the patient now. The drape pack has been opened, you can see just behind him. And he takes the pack, and you see what mistake he's made here? Ashwin?
With the other hand.
Yes, he's dropped his hand down, okay. He should have his hands above these arrows here. So he's opened up the drape and he throws the covering on the floor. Okay, rather than handing it to somebody. And these packs have got an indication of which is the top of it and which is the bottom of it.
Sir, Anand is trying to join.
Thank you. Okay, so you tear this off, and this is the sticky bit that goes onto the face and sticks to the face, which with the cloth one you can't do. So you tear that off and throw it on the floor, and then you position this over the patient's face, and you open it out sideways like this. And then you take it over the head, and then when you take it going towards the back, you make sure that your hands don't touch the patient's clothing when you do this. because of the stickiness around the face there, the first thing you need to do is to put it onto the nose without it touching the face. Otherwise, you find that it's stuck to the nose and it's somebody wants to be let in, but there's no way of doing it. You can have it stuck onto the nose and onto the cheek, and there's a gap between the side of the nose and the drape. So you have to run it down the side of the nose and then onto the face. Did somebody say something? Hi, Sally.
Hi.
Now this is the that tubing we looked at earlier, which is going to attach to this is the aspirated tubing that's sterilizable, and it's going to be attached to the aspiration system. And he's holding it about almost a foot away from the end, so that when the roving assistant takes it, they can take it without contaminating the person's aseptic glove. Okay. Then what you do is you lift up the sides of the drape, each side of the tubing, and you put on a Lorna clamp. This Lorna clamp has no sharp beaks on it, so it doesn't cut through and touch the clothes of the patient and get contaminated.
I need to leave.
Okay, we'll send you the video anyway. Can you wait 3 or 4 minutes, Eldo?
Okay, yeah.
Okay, he shouldn't have his hands drop down. Now, when you put this, when you attach it to the drape here, you then need to pull it through enough so that it easily goes into the patient's mouth. If it's too short, it's frustrating when you come to use it because it pulls on the drape. You then hold out the implant motor like this. You notice this implant motor has been sterilized. Have you checked on yours yet, Tejas?
No, not yet. I'll check tomorrow.
Yeah, so much easier. Do you put a sleeve on it?
Yes,
Yeah, that's a real pain.
it's a pain. Yes, yes.
Can you sterilize yours, Eldo?
So after my first incident, I've never done that.
After what?
After my incident with you, when you asked me to sterilize it, we put it in the autoclave and then it stopped functioning.
Yeah, did you check with the manufacturers to see if it'll do that?
They say it is safe, but I tried it twice.
Yeah.
Then I stopped. And then we had to put it, this is how we overcame it. We put it in the sun.
Yeah.
Oh, okay.
Yeah. And probably it dried up all the water and then it started working again. They
Wow.
say it is sealed, but I think it didn't work. It's not sealed.
I don't think I've ever used a sleeve to cover one of these. And then this goes underneath the
I don't know.
If it's a non-vacuum autoclave, I think the water will damage it.
Okay, I started doing implant in 1990, and I've autoclaved the motor every single time. But you use the sleeve if you'd like to. Okay, if you enjoy. Every time you use the sleeve, you think of me. Okay.
Okay.
So you
how do you sterilize the tubing that goes into the implant physio dispenser?
Tubing.
The line, the IV line.
That
the
is
saline.
The saline, yes.
Okay. This comes already in a sterile pack.
And okay, if you want to, can that be autoclaved if you want to use it again?
I don't think it can. What do you use? A syringe for the saline?
No, I use the tubing. The motor I bought, I got about 5 sets of tubing. I've exhausted my last one, so now I need to find a supplier, or I need to sterilize that again.
What do you use?
There
Elder?
is something called this PO tube.
PO tube, okay.
Yeah, it comes with the same diameter like our the saline tube, and we can cut it and do some adjustment. We used to do that in college.
Stuart, for your question, after I saw the slow drilling technique, I very slowly irrigate from outside the saline
Like a syringe.
with a syringe, because they say they have done a study in which they say there is no need to drill very fast. If you drill it with high torque, with like how you with an implant speed, you can get good amount of bone also. So after that, I've always tried very slow speed to go in with limited amount of saline from outside.
Eldo, can you send everybody that thing I sent you?
Yes, I'll send you.
Okay, and send it to me, because then I'll put it into my presentations, okay?
Yeah.
You
And
don't
that
have-
guy is a brilliant guy. The guy who was, I know him personally.
So that means you don't use that tubing, that narrow tube. You don't use it anymore.
No.
We-
I'm syringing it from outside, but presently I drill very slowly.
What speed?
Same like implant speed, 50
20
RPM,
20 RPM.
35-40 newtons.
Sorry, how much, what speed, Eldo?
50 RPM and 35 or 40 newtons.
The implant
Cool.
goes in at 20 RPM.
Yes, but you require a little bit more of speed, more of torque to drill into hardboard.
Okay.
Yeah, but it's when you drill it, you'll feel it's just going like like an implant speed only. It goes in very slowly. It goes in, and you get good red bone. You get.
The this slow drilling technique appeals to the CBs amongst you.
In short,
All right.
The slow drilling appeals to CBs.
I don't
What's a
know that.
CB, Tejas?
You don't want me to say it. Okay.
Oh,
The cheap bastard.
cheap bastard.
oh, sorry, I again forgot. So why is
Okay.
that? Why do you say that, sir? Oh,
Well, you don't
because
have
of
to-
the tubing.
you don't have
because
to
of
pay
the
for the
tube.
sterile saline tubing.
Okay.
No, it's not that. You get viable bone with that. You don't lose the bone that you're drilling. That's a concept. I'll send you that video.
Sure, please do. That'll actually save me a
And
lot of trouble.
Stuart, when I did my AAID in probably 2007, there was a guy called William LeConte,
Yeah.
who was advocating this.
What was
At
his
that
first?
time,
What was his
William LeConte. William LeConte.
Yeah, I think I know. Yeah. Okay. Djokovic has won the first set. Are you watching Wimbledon at all? Are you watching the football? We're in the final.
Yes, waiting for the final.
You are?
Finally after what, 50 years, 60 years?
Yes. Yeah. Ridiculous. We have far too many foreign players in the English league. That's why. Did you watch the match against Denmark the other day?
Yes, I did.
Good, wasn't it? Yeah. I'm much happier when England wins. Okay. How are you, Sally? Okay.
Yeah, sorry, I had a long day today. In clinic, then at home. I couldn't join early.
Yeah.
Same
I'll
here.
send you the video anyway.
Yes, looking forward.
Okay. You're going to
While
do,
using an electrosurgery, is it necessary to use irrigation or is it dry?
dry.
In between for the tissue tags or something?
Oh, you can wash it with 3-in-1. Yeah, but you need it dry. Okay.
Right.
The other thing is, have you practiced on a piece of meat?
No.
Okay. You get a piece of meat. Okay. And
Yeah.
you run the electrode along the meat, and you see if it cuts. Okay. If it's set too low, it'll drag. All right, and it'll damage the tissue. If you have it too high, it sparks.
Okay.
Okay. You need to have it slightly under spark. Okay. It's better to have it slightly closer to the sparking level than it is on the lower level. Because the lower level will damage the tissue. Okay. So you need to practice on some meat.
Okay.
Okay. Eldo, you have a vari-tip, don't you?
Yeah, I have a very tip into which I cut the orthodontic wire and keep it every time.
Where do you where did you get the vari-tip from?
No, it's not actually a very tip. The tip broke, and then it is my own technique. The original tip that came along with it, it broke after a few times of using. Then I saw another dentist using the same way. So I
Eldo,
started using it.
Eldo, Eldo,
Who's the supplier?
where did you get your vari-tip from?
That's from TCS, Cold Tea.
Okay.
It's not called very tip. They supply only three electrodes, of which one was a straight electrode, which broke. So I started, cutting and putting orthodontic wire into it, and it works very well.
Yeah, what we're interested in is the actual electrosurgery tip that you've got, that you put the wire into.
That's from TCS, Cold Tea.
Okay. You're going to be sending that to me, aren't you? The information.
Oh yes.
I'm writing it down.
How is Sally's working?
Say it again.
Working pretty
Really? Can you send some pictures of your, after surgery?
good. I will send you one as
Yeah.
just now. I don't know if it looks that great. I'm still learning. Today's looks a little, the tissue tags are not that clean, but I'll still send you.
Yeah. Presently, all my
And
posterior crown preps, I do surgery.
Colteen is way superb. I've heard from many people, but it's almost 10 times
Yes,
costlier.
yeah. So if yours is working very well, then I will
Now it's
buy one.
close to 90,000.
If yours is working very
Sorry,
well,
I
then
didn't
I
get
wish
you.
to buy one.
I don't know if you compare, you would be a better person because you've used Colteen. I really don't know what to expect. So let me send you the
You send the
photographs.
pictures once Corona is over, and then probably we can travel. Then probably once when I come there, then we'll compare and then buy.
The
But it's a
vari-tip.
great thing to have, really.
The vari-tip is going to last longer than you do. So it's cheap in the long run.
And one more thing, everyone, I found another electric handpiece manufacturer by the name Coxa. which costs only 65,000 for the electric
Yeah.
handpiece and the
I saw that.
motor. Yeah.
Yes.
So I'm trying that also. I have a W and H, and then trying this also. For 2 days, I've been using Coxa also.
You mentioned that you use electrosurgery on posterior teeth. What do you do about anterior teeth?
Retraction cord,
Why do you use electrosurgery?
because you had suggested that that can cause recession in the anteriors.
The buccal,
Yes.
the labial, not. I would use it mesially, distally, and palatally.
Okay. Yeah,
Routine.
I've not tried that. Yeah.
The only part you don't use it on is the buccal, because if you do get any tissue recession, that can be embarrassing. Okay.
Okay.
So, Sally, make sure you practice on some meat, so you know what setting to use and how to set
Yes.
it. Okay, doke.
Okay. Okay.
And in the upper, you need to put in a palatal in a local anesthetic. And in the lower, you need a labial as well as your mandibular block.
Block.
When you're doing a cramp operation, do not use
Okay.
local anesthetic.
Okay. I've tried.
For
Yeah.
the items required in general dentistry,
What is that?
Stuart has sent the list, right? For the items required for general
Yeah.
dentistry. You want us to give you the dealers' numbers. So these are commonly available in local dealers. Do you want amalgam pluggers and ball burnishers, and do you want dealers for all of these, Stuart?
Probably not from
These
the
are all local dealers.
probably not from the most common things.
Okay.
Okay. What I'd
Yeah.
like is next to the less common things, you put the name of the dealer,
Hmm.
and then at the end, on the last pages, you put the dealer's information.
Okay.
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 Sally, Abby, if you could do that to the one you sent me.
Yes, sir.
Okay. I think the one you sent me has a little bit too much detail. It's
Yes.
very thorough, very thorough. Yeah. Okie doke.
Okay.
Okay. I've just sent
Yes,
you
sir.
the slow drilling protocol. I've just sent you.
Yes.
Okay.
All right. Bye bye.
Can you send it to the group?
Ashwin? No, Stuart will share it with the group. I've sent it back to Stuart.
Okay.
Okay.
Thank
I'm
you.
now going to have a lesson from TJS. So
One more thing I want to tell. Have you tried Articane, Buckley, and Linguli on crown preparations? I've tried it till first molars and it works very well in the lower.
So what's the benefit?
Articane.
So what's the
No,
benefit?
instead of a block, you mean?
Instead of lignocaine, give buccal and lingual Articane till first molar lower it works without a block.
Okay.
They say the
And,
penetration power of Articane is more.
And it also comes in your normal lignocaine bottle.
No.
Cartridges.
Cartridges. Only Septodont manufactures them.
Yeah,
What's the
Septodont.
cost of the cartridge, sir?
65 rupees each cartridge, 1800 for a pack of 50, and 7
And,
rupees for a needle.
One cartridge for one patient.
Yes.
Sometimes two.
Sometimes two. Okay.
Yes. And a new needle for each patient, so that's 7 rupees. So yeah, you can't be charging less with that.
Why do those needles have expiry dates?
I don't know.
Sorry?
Yes, I found when I moved from one practice to another, I found some needles which were about 5 years out of date. I thought I threw them away, but I mean, how on earth a needle can be out of date? I don't know. Okay, see you next week.
See you next week.
Yeah.
Okay,
Yo.
bye-bye. Bye-bye all.
Cheers.
Bye. Thank you.
Bye bye. Stuart, get on the call.
Right. I'll send you a team view, okay? Mhm. We might have to go on to how are you, Abby? Haven't seen you for a while.
Yes, I couldn't attend the last session. I had patients, so
Hmm. How many patients are you seeing a week now?
so 4 or 5, yes. But only consultation. We are not doing any of the work. Only consultation. I mean, only seeing, not consultation.
I see. Okay, Abby, I look forward to seeing you next week, hopefully.
Yes, sir. Same here, sir. Bye, sir.
Bye.